So I'm trying something a little bit different with my blog now that I'm out of remission again, and typing sometimes it's just a really big task considering how bad I feel. So I figured a video blog would be better because there's just so much to talk about that writing would just take way too long. So I am still on the hunt for a hematologist that will give me Rituxan in South Florida. I have another CBC tomorrow, and I am hoping my platelets went down. I know that sounds crazy, but I'm being told at 115,000 platelets while on prednisone that I'm still too high to treat, even though I dropped 53,000 at the end of March and then started taking prednisone. So a little frustrated, but that's what I'm dealing with right now. I started doing more research into where we are on researching ITP. Found out today that somebody in the ITP community had passed away recently, and that's always sort of a kind of a kick to the gut because I joke about like not wanting to die, but the truth is that this disease can kill you if it's not treated, and I'm not getting like treatment, so I'm a little frustrated. But I came across something today. It was an article that really struck me, and it was posted in a veterinary medicine, I guess, journal back in 2011. And I started to really get into veterinary medicine after Kona got sick and passed away from her brain tumor last year. And Dr. Bentley, Kona's veterinary neurosurgeon at Purdue, had a dog, his own pet dog, that had ITP. And he had actually made a comment to me that he didn't even know humans got ITP. And it was something that we want to address through this bill, the Kona Act, that I was working on, and I've kind of had to shelve now that my health isn't doing so well. But I found this article, and it was called Treatment and Predictors of Outcome in Dogs with Immune-Mediated Thrombocytopenia. And it was through the Cummings School of Veterinary Medicine at Tufts University. Ultimately, what I gathered from reading this article is that ITP presents in dogs like ITP presents in me. It's the autoimmune destruction of platelets. So this is actually really good news because this means we have a naturally occurring animal model for patients like myself. And one of the big things that I want to see happen in ITP research is that we start understanding that there's different types of ITP. And for some reason, we haven't done that, despite the fact that there was a bunch of research done in the early 2000s, and then they developed 2 drugs based off of that, because the first type of ITP was my type of ITP, immune-led destruction of platelets. Then they discovered that your bone marrow may not be producing enough platelets, and there's much more science behind it, but I don't want to bog people down who are my friends who are watching this that aren't as scientifically advanced as like rare disease patients and researchers and things, because we tend to, if you're living with a rare disease, you tend to know the ins and outs of medicine when it comes to your condition. So ultimately we have 2 drugs on the market, Nplate and Promacta, and they stimulate your bone marrow to produce more platelets. And those are for patients with ITP who have trouble producing platelets. And it's really great that there's 2 drugs for that on the market, and I know people that are doing really well with it. But there's really no drug on the market designed to deal with the B cell-led destruction of platelets. And so dogs may provide the perfect model, just like I am saying that dogs provide a great brain tumor model, because dogs get brain tumors naturally. And we do a lot of our scientific research on mice, and mice aren't necessarily the best animal model. So I have a little bit more pep in my step when it comes to this part of the project, because I would love to see us be able to create a drug that could help canines and humans. So I'm going to circle back on the Kona Act, hopefully soon if I get a treatment, to look at this. And I'm also going to start digging into what other veterinary research is being done in this space, because when I wrote that article in 2015 that went viral on my use of Rituxan for ITP. Actually, a lot of people reach out to me and say, I hope you're not offended by this, but like my dog has ITP. And I always go, oh, okay, well, dogs get ITP. Oh, that's interesting. Now it has a lot more weight because I'm seeing what's going on with the lack of drug development and proper research in this field. So I would like to see us start understanding ITP better and the way that it manifests itself in patients differently. There's different clinical manifestations. And I talk to other patients who are all for this designation, but it doesn't seem like our patient group is. I should say the organization that claims to speak for ITP patients. So there's going to have to be a shift in that as well, because we'll produce better drug targets if we start looking at this. You're not going to be able to run a clinical trial on a CD20 inhibitor for ITP and get great data sets if you give it to every ITP patient. Because if an ITP patient has trouble producing platelets in their bone marrow, a CD20 inhibitor isn't going to help them. Just like you could give me N-plated Promacta and I could make 1 million platelets. I'll make 1,000,001 antibodies and kill every single one of them off. So we need to do better. If you have a dog with ITP, please feel free to email me or reach out to me on the contact form on my website, rarecandace.com. I'd love to know how your dog was treated. Generally, their first line of treatment is prednisone, which is unfortunately what we get too. And dogs suffer from the same side effects that we do with prednisone. And actually, Kona was on prednisone when she was first diagnosed with her brain tumor and had the same thing: increased urination, increased thirst and hunger, a little bit of trouble sleeping. She wasn't cranky, thankfully. I get very cranky, and I think a lot of roid rage happens. But I have read and heard from other dog owners that their dogs get cranky on prednisone. So that's where we are right now with this, and I think it's pretty interesting when you can talk about your rare disease and dogs get it too, because it kind of changes your perception on the disease a little bit more. But it also presents to me other opportunities with research that I don't think we've explored fully. And since I know that dogs are more closely paired with my type of ITP, it gives me a better opportunity to really dig into what other scientists have looked at so far. And I may be able to pull inspiration from some of this research for further projects. And it also may provide some additional leverage for me to get care. And I am going to be looking to see if there were any immune mediation techniques or therapies that have been used on dogs with ITP, so we can see if there's something out there that I can use to try to convince my doctor this week to give me this drug, because I'm not feeling well. You can't tell on camera, but I used one of those pore strip things in my forehead today because I'm unfortunately breaking out from prednisone, and I pulled it off very gently and I had petechiae. That's a bad sign. I don't get petechiae like that. My platelets are dropping. So I have a CBC tomorrow. I'll get the results Tuesday. From there, we'll see what happens. I'm probably going to have to have a very dramatic drop to get anywhere, but that's why I'm also pursuing trying to find another hematologist within South Florida who will treat me. I would go out of state, but my insurance wouldn't cover it. I have to be gone for too long, and I can't relocate for 4 to 6 weeks to see a doctor and get this done, and develop the type of relationship necessary for him to prescribe me an off-label drug. So that's where I am right now. But if you have a dog with ITP, if you're a scientist, researcher, clinician, doctor, of human or vet doctor dealing with this, I'd love to hear from you. And again, if this reaches a pharmaceutical company, I want to talk to you guys. We can do this. We just need to, there's patients and all kinds of stuff out there. I just need to get in front of the right people and have this discussion, because there's a huge opportunity here. I've had a lot of really bad things happen to me over the last few years. And I always try to wonder, what's the lesson, or what is the universe trying to tell me, because all of these things keep happening. And when Kona died, I had a lot of questions, because I felt like it was just so unfair that I had lost so much in such a short period of time, and her death was so tragic, and we did everything we possibly could to save her. And if you don't know Kona's story, she was diagnosed with a brain tumor. I drove her to Purdue, and she had Dr. Timothy Bentley, a veterinary neurosurgeon from Purdue, and Dr. Cohen Goodall, who is a human neurosurgeon and is the creator of the Neurosurgical Atlas, remove her tumor at a human hospital in downtown Indianapolis, and they parsed up the tumor. There's a piece being stored at Purdue. There is a piece being used to develop an immunotherapy treatment for glioblastoma, and a piece was sent to pathology, which confirmed a diagnosis of oligodendroglioma. So, which is a glioma-based tumor in the glioma family, which also in the glioma family includes glioblastoma, which most people have heard about because Senator McCain has died from it, Senator Kennedy, Joe Biden's son, Beau. Lots of people have died from GBM, unfortunately. It's a very nasty cancer. And we don't know why Kona died. She died 3 days after her surgery. She had been recovering. And so it was just heartbreaking. But it launched me into this world of translational medicine. And then just the sort of parallel universe between vet med and human med, where we get the same conditions as the animals we share a bed with. And now that I have Rico, I sometimes look at him and go, like, what could you have that I could have too? And so I think that now that I am looking at ITP and I'm faced with this situation again, it's definitely driving some decisions and having me take a closer look at stuff that I think has been seriously neglected over the years, especially on the patient side for ITP and on the human side. So I'm looking at that. But this is the first of many videos, and I am hoping that this will start to inspire people to take a little bit more action. And keeping my fingers crossed that this week I can finally book treatment, because I'm suffering and we need a drug on label for this, and we need to do better. So again, if you have any questions, comments, things to tell me, rarecandice.com, or you can email me rarecandice@gmail.com.